More than 117 million people, or about 35% of the nation's total population, is fully vaccinated tonight. And today, the CDC opened up a whole new group to get the vaccine, all kids ages 12 and up. And joining me now to talk more about the vaccine, some of the concerns for kids and more importantly for parents, is Dr. Jay Bott. He's a primary care physician and instructor at the University of Illinois School of Public Health. There is a lot of concern around the vaccine for this age group and even younger kids, which we'll get to in a moment. But I'd like you to address the hesitancy that we're seeing among some parents who aren't necessarily anti-vaxxers. They typically get their kids the vaccine at well checks for other diseases out there, but they're worried about the pace of this vaccine. How would you address their concerns tonight about the safety of this shot?
Good evening, and thanks for having me. Glad to be here. I would start with saying that this is a tremendous step forward for beating this pandemic and for getting our country vaccinated. The data continue to show that the vaccine is safe and effective. And so I would urge all parents to call their pediatrician, their family doctor, or their local pharmacy to learn more about how to get their children and teens vaccinated. Now, I would reinforce that in the vaccine trial that just concluded some time ago, there were no cases of COVID-19, and the vaccine was 100% efficacy. So that's important. The other is we know teenagers can get things like long COVID, which have debilitating symptoms, and that's something you'd want to avoid. Student athletes can have impacts on their heart that are long lasting. So that would require monitoring by a cardiologist, and we would want to avoid that. And a vaccine can certainly help keep your kids protected. So I would encourage them to see how they're feeling about it. Ask the kids how they're feeling about it, what they're hearing from their friends or teachers, and most importantly, talk to your pediatricians. And they'll be available starting tomorrow. And so just applaud the stakeholders, FDA, CDC, and Pfizer certainly for moving quickly on this regard.
In that same vein, how long before we have some real data and research that shows any potential long-term effects on our younger population down the road?
I think the studies are continuing to be ongoing, and I know that the studies for younger populations are happening now and will continue to happen. And so we'll learn more certainly by the fall. We also know that this is an important opportunity to bundle immunizations. We know kids are behind, and we'll also want to learn and study that as well, about what it looks like to give people a number of different immunizations together. We've done that before, and it certainly is something that has been supported by the science in terms of COVID-19 being part of that bundle.
One thing I'm sorry, I didn't mean to interrupt you. One thing that I have heard from some parents, and I've read this in a number of news reports, is there is, of course, the chance that kids can get COVID, but they don't get as sick. And so you hear a certain segment of the population saying, well, my kids aren't going to get sick from it, so why do they need to get vaccinated? Can you address the public health standpoint at this point in the virus in that vein?
Sure. I think this is really important to question, because we know that for kids, sometimes this can be asymptomatic, so they can be spreaders. And if they're out in public, they can spread this to others, but also within their homes, not only to themselves, but to others in their family and community that may not be vaccinated. And so getting the population is going to make getting the population vaccinated is going to make a difference in the dynamics. Because we've known all along that adolescents tend to be more likely to get infected and spread the infection relative to younger kids. So even this population being vaccinated will make a big difference for that kind of community of young people as we try to get past this pandemic.
And real quick, we do anticipate that there will be approval for the vaccine for the younger age group, the toddlers, the elementary school kids, sometime this fall. What's your message about that age group?
I think that they should also be ready to get vaccinated, should want to still stay safe, mask up, and keep your distance, because they certainly, just as adolescents, although at lower rates, can still get infected and pass that on to others.
All right, some good information tonight, Dr. Bott. Appreciate your time.
Thank you for having me.
Of course.